does a woman get this disease, and why are we as Indian women so susceptible to it?
Yeah, cervical cancer means a cancer which begins in the cervix. And the cervix is the lowermost part of the uterus or the womb, which projects in the vagina. That is known as cervix. So the cancer which begins in the cervix is cervical cancer. What was your
Right.
next?
Also, we wanted to know, how does a woman get it? How do we really develop this disease?
HPV, persistent HPV is the cause of the cervical cancer, and HPV is, that is the human papilloma virus, is sexually transmitted virus and is the main cause of the cervical cancer. But there are the other risk factors as well. Early sexual activity or sexual activity at the age very early, sometimes in the teens, and then basically the multiple sexual partners and also the multiple sexual partners of the partner. If the girl or the woman smokes, I think smoking is another reason. And the HIV, if anyone suffering from HIV, there is increased risk of cervical cancer. So these are the risk factors for the cervical cancer.
Dr. Joshi, very importantly, as you mentioned, it seems that during the young age, we have to be very careful. Young girls, and even for that matter, young boys, have to be very careful about their sexual life and sexual experiences.
No, earlier it was not.
Oh, okay. So
This
right
time
now
it
there
was
is
irregular, broken voice.
Okay.
Voice was broken.
Okay. So let's begin again, shall we?
Yeah.
Dr. Joshi, as you mentioned, it seems that young boys and young girls have to be extremely careful about their sexual health in their formative years. And that sort of lays the foundation for what risks of diseases that can happen later in life.
This is a very important point which you have really brought out. And that is what actually exposes, the risk to the cervical cancer. Early sexual activity. So early age at the sexual activity is very, very important factor for actually, rather, that is one of the risk factor for cervical cancer.
Right. And how can we ensure that they are safeguarded from this risk? We as parents, and also young adults, when they become, when they take their own health in their own hands and decision making in their own hands, how would you suggest that they safeguard themselves?
They require to be educated properly. As a parent, we require to take care of our children, and especially the girl child. And we require to make her educated about the sexual health and also the risk which can lead to the problems in the future. And it's important to also to impress upon the need for the vaccination for the dreaded diseases like cervical cancer. And that's how, if the child knows about it right from the beginning, she has been given some kind of education that it is the proper sexual health is important, and she has to really prevent herself from the sexually transmitted diseases, as well as she has to actually have the quite mature thinking about it. She definitely will incorporate it into, and what is important is the awareness. And once she is aware, definitely she will choose that she doesn't have to go for, the you can say unhealthy sexual life. And also she doesn't have to smoke. She doesn't have to be having, sexually transmitted diseases, because this is the cancer which is caused by the sexually transmitted virus, that is human papilloma virus. And I think we all are discussing about the HPV right now.
Right, absolutely. So, one thing that needs to be told to the young adults is, when they're entering into a sexual activity, they should be safe about it. They should
Right.
use safe practices, use condom, be careful about how many partners you have, and be careful and be mindful of what you're getting into. Ma'am, that understood. I want to understand now, what is this vaccination? When can it be taken? And how does it protect? And does it give 100% protection?
I think these are very, very important questions. The vaccination means, as you are aware, that we are taking the other vaccinations as well, and the vaccination means it's a primary prevention for that particular infection. So HPV vaccination means this will prevent the girl from getting the human papilloma virus infection, which is the main cause of the cervical cancer. So it will protect the vaccinated individual or vaccinated girl from that of the cervical cancer. Now, this should can be given from the age of 9 years to that of 27 years. This is what is the preferred age group in which this vaccine can be given. But this is most effective in the age group from 9 to 14 years, means under 15 years, and also up to 27 years. But when it is given after 27 years to 45 years, of course, the protection of the vaccine in preventing the HPV infection, or in a way, the cervical cancer, that reduces. So it's very, very important that any woman who is of the age group of more than 27 years required to be actually consult before taking the vaccine, because they may have the precancerous condition right there that requires to be treated as well. So they
Hmm.
must take the opinion and also the consultation before going for the HPV vaccination in that particular age group.
Right. So, as parents, what would you suggest that when is
So,
the right time to get a girl vaccinated?
it should be between 9 to 14 years. That is the right age for the vaccination, because immunity is maximum during this period, and also the girl is not sexually active. So before the sexual exposure, the efficacy of this vaccine is maximum. And the other question which you had asked was whether it is going to give the 100%
Yes.
protection.
Yes.
Suppose it is important to understand that the number of dosage taken also makes a difference in the effectivity. So one dose also gives a very good protection, and that is in the tune of say 85% or so. But
Okay.
87% can, or 88%, I think recent studies are showing that even one dose can give you the 90% or above protection. But when two doses are given, the protection to the girl is the tune of 92 to 97% protection for even against developing the precancerous condition.
Right. Right. You can continue, ma'am. We'll chop that out.
Yeah. So actually, it is important that even after the taking vaccine, we cannot say that it is the 100% protection for the cervical cancer. So even then, every vaccinated woman will have to undergo the screening test. And it is important to diagnose any kind of the precancerous condition so that we can prevent the cervical cancer and give the efficacy, or rather, give a much better control of the women in general.
Right. So, ma'am, this as a on a personal level, what a woman should do, or a young adult should do, we've discussed. But on a national level, why is it that women in India are more susceptible, or that women in poorer countries more susceptible to this cancer?
Yeah. So women in, it's not the question of women in India, but in the sense actually the women anywhere for that matter. In India, what we are talking about is our own actually uh, the women of our country. It's because we are concerned about their health.
Hmm.
And that is why actually we are looking at, how effective the vaccination program is, how much we can go for the effective screening program so that we can prevent the cervical cancer. But at the same time, we have to make sure that we have good actually facility to treat the cervical cancer as well. So in order to eliminate, if suppose we are talking about the disease of the cervical cancer, as I think WHO had given its call, that was in 2021, that let's eliminate cervical cancer globally, actually from the globe, and which is feasible, which is possible, but there are three pillars to to fulfill the criteria. One is that the 90% of the young girls, they should be vaccinated in
Right.
any of the country. And actually the the screening, that should also be around, say, 70% of the women of the country must be screened, so that we can detect the precancerous condition and we can protect the cervical cancer. On the other hand, there should be the treatment facilities, and the woman should be treated adequately once diagnosed of the cervical cancer. So actually the screening will detect more patients in the very early stage, where they can be treated very effectively, and our aim becomes with the treatment to give them the good quality of life.
Absolutely.
In early stage of the disease, the women think that once it is diagnosed as a cancer, it's not treatable. But let me tell you that the success rate of the adequate treatment, or even with that of only surgery, is 97% or more of the very early cervical cancer. That's why
Yes.
we require to aim at a very early diagnosis. First of all, prevention and the early detection, so that we can treat them effectively.
Absolutely. Uh, Thank you very much, ma'am, for this education that you just gave us. And I'm sure that this will help young women and women who are mothering young women to be able to take an informed decision. And I'm sure that as medical science progresses and as more focus comes on the disease itself and women's health, the cost of preventing these diseases for us individuals will also go down. Thank you very much for this information. Thank you, ma'am.
I just want to make one comment, if you can allow me.
Yes, please.
I very much, I think it's the announcement by the government of, you know, encouraging the vaccination among the girls of 9 to 14 years is a very remarkable actually decision on the part to prevent the cervical cancer. And I'm sure this is going to make an impact for the access of the vaccine to those girls who are not where the vaccine was not accessible. They will be able to access the vaccine, they will be able
Correct.
to prevent this disease, and definitely it is going to go in a long way for towards the elimination of cervical cancer, for which we all are
Absolutely.
working actually, from the point of view of the protection, prevention of the cervical cancer, and also
Absolutely.
the
Yes.
elimination. So I think
Absolutely.
it's a great step.
Absolutely. And we do hope this is a successful endeavor and women take the onus of their own health in their own hands and women are
Sure.
safe and healthy in our country. Thank you very much, ma'am.
Thank you.